Coming up, we'll be on location at the Maryland Oral Surgery Group in Upper Marlboro, Maryland, discussing the latest advances in dental implants and how they can replace your missing teeth and restore your dental health so you can smile and enjoy the foods you've always desired with one of this area's top oral surgeons, Dr. Sharon Russell. Dr. Russell has been recognized as a top oral surgeon by Washingtonian Magazine. Welcome, Dr. Russell, to Top Doctors Interviews program. It's great to have you on again.
Thank you. Nice to be here. Nice to be here.
All right. There's been so many advances in oral surgery, and there's so many benefits from those treatments and procedures that are available. Can you please begin by telling us what some of those treatments or procedures are?
Oh, yes, of course. One of the main advances in oral and maxillofacial surgery has to do with replacement of teeth. Mainly replacement of an entire arch of teeth, and that's called teeth in a day.
Now, I wanted to ask you, how is that performed?
So initially, there's a workup that goes along with this procedure. So the patient will come in. We will, of course, talk to them about their aesthetics, have them bring in pictures, and try to reestablish what they had before or something better. We'll take impressions. We will do a cone beam on them so we can digitally plan and place implants and also see if there's any bone deficits. And then pretty much we coordinate with the lab. Patient comes in on that day based off the digital plan and the wax up. After we present that to the patient and they're happy with the way the teeth look and, you know, the bite, then we will set up for the lab to come in and we'll plan to digitally place the implant. Sometimes it's 4, sometimes it's 6, and then that will be screwed in to the implant. And that is the temporary denture. So that'll be in place for about 3 months. We'll have the patient eat a soft diet, and then after the implants are integrated and they heal, they'll come back and we'll convert that to a permanent implant retained denture. And most people are really happy with the results.
Well, that sounds great. It seems like you really take the time with each patient because no two patients are the same, and you go through the entire detailed procedure or process to kind of understand their needs so you can have the best outcomes for each patient.
Yeah, exactly. And that's what we pride ourselves on. Individualized care, trying to meet the needs of the patients and exceeding their needs so that they would want to share their experience with their friends and their family, you know, for me to do this work on their loved ones.
And we spoke to some of your patients and they love what you've done for them. You're really doing great work in the community.
Yeah. Well, I'm committed. I don't take this just as a job. I treat every patient as though they were a family member. And I didn't get into this for the money. I got into oral surgery because I really care. Like, I truly care about my patients and I truly care about the outcomes.
That's wonderful. And that's what makes you a top oral surgeon in the community.
Okay. Well, I want to keep being the top. All right.
That's great. And what are some of the key benefits from teeth in a day compared to other options?
So other options compared to teeth in a day do not restore or help to maintain the bone integrity. If you go with a conventional denture, the denture is removable. So that's one disadvantage. You're going to be able to take it out. It actually accelerates bone loss by having a denture. And there's nothing inside of the bone. So with teeth in a day, you have implants that are actually embedded inside of your bone. And as a result of being embedded inside of the bone responds by turning over and making more bone. So you don't have bone loss. You actually have continued bone deposition or bone growth. So when we look at those patients, aesthetically, their face is more full. Functionally, they can chew and bite on things because this is a stable unit. It's not something that's removable. For an edentulous and a completely edentulous patient or a patient that's missing teeth, really the only option would be either this or a denture, and we have one other option that would be an overdenture. That's where you have a few less implants. So there's fewer implants and this snaps on, and it's a little more, you know, cheaper in cost. But for most people, they want to go with something that's fixed and not something that's removable. But if you can't afford, you know, the type where this is screwed in, then a secondary option would be to get the snap-on.
Well, this sounds like a great option because you're not only getting your teeth back, you're able to eat the foods that you love to eat, and getting the bone structure back can help you look a lot better, more aesthetically handsome or beautiful, whatever the case may be. So it's really life-changing.
Most definitely. A lot of these cases that we do, the patients are so elated. And, you know, one of our patients, she went out and bought a new Mercedes. I mean, she was like 60 years old. She started dating a younger guy. So another patient that we did, they sing in the choir. They weren't worried about losing their teeth or popping out and not able to enunciate words when they sing. So it definitely is life-changing, functionally, aesthetically, and just your overall, just how I feel about myself. So it's an amazing product. We want patients to know about it, and we want them to know that we can deliver a service that's secondary to none and have a majorly positive outcome.
That's great. And Dr. Russell, who's a good candidate for Teeth in a Day?
So patients that have periodontal disease, meaning teeth that are loose or mobile, patients that are missing all of their teeth, patients that are maybe missing just a few teeth, patients that have diabetes that's well controlled, or even some kind of autoimmune condition like cancer or even HIV. Those patients, you know, may want to feel good about having a better smile. So they are candidates as well. And even people that smoke. Some people think that if you're a smoker, you're ineligible to get implants, but that's actually false. It's just the approach that we take would be a little different, but it doesn't exclude you from the treatment.
So it can really help a lot of people, because so many people have missing teeth or issues with their teeth where they need teeth or dental implants, and this can really help them.
Yes. One of the major things in this society is that we judge people for having missing teeth. One advantage during this time is that we're all wearing masks, so we can't always see that. But people tend to think that you're of lower socioeconomic situation or that you're poor. So people judge you by having missing teeth. So we want to replace those teeth. We want to maintain that bone integrity. We want you to maintain that youthfulness. We want you to have that function. So call us today.
That is a very good point. We are unfortunately a judgmental society, so when we see someone missing a tooth, we do prejudge, and it can stop them from getting a job or getting the promotion or relationships in their life. So it's definitely life-changing, as we mentioned.
Yes.
So once a patient has received the Teeth in a Day or the implant procedure, how long do they typically last?
So these implants are 98% effective, and they can last a lifetime if taken care of properly. The care that is involved in implants are, you have to see your dentist once they're placed for your routine cleanings. With the actual implant retained denture, you're going to have a substructure, okay, in between the actual teeth and the actual implant. So that has to be removed by the dentist or your surgeon and cleaned. That should be done at least twice a year. But if they're taken care of well and you clean just like you normally would, use a water pick, brush, they can last a lifetime.
And that's not unlike your normal natural teeth that you were born with. So
Correct.
It's
right.
basically getting your teeth back.
You definitely are getting your teeth back, and you're definitely getting your smile back, and you're getting your life back.
Well, thank you so much, Dr. Russell, for being a guest today on the Top Doctors Interviews program. Teeth in a Day seems like a wonderful option, and it was very informative.
Thank you. Thank you.
I had a tooth problem. One of my back molars was causing me some pain, and I went to another dentist, and they said that it needed to be extracted, and I'd probably have to have an implant. And that doctor was not that dentist was not a surgeon, so they recommended Dr. Russell. Very impressed with the office. It was very laid back and everything, and you know, I'm not a very good patient, I must admit. So they made me feel at ease, and they did the extraction, and then there's a period of time, a healing period, and had to come back for several checkups, and then the implant was put in. I mean, I'm impressed with the results. They bring you in, and it's like a family atmosphere, and they put you at ease, and constantly during every procedure that I've had here, she's constantly asking you, how do you feel? Are you feeling any pain? And then if you are, then she takes care of it right away. I don't give recommendations very often, and the reason is that when I send somebody to another vendor or somebody or a doctor, that's my reputation. I'm saying I'm vouching for that person. And as a lawyer and as a naval officer, you have an obligation to, you know, carry on with holding close those recommendations. And so it's valuable to me that if I recommend you, then the person that I send to you, they're going to be treated just as well as I was treated. And so if you could do that, then that's what I'm looking for.
I was having some pain in a lower molar, and I saw my dentist, who referred me to an endodontist who did one of those special x-rays and determined that the root of the molar was cracked and that I had some significant bone loss there, and advised me to see an oral surgeon to have the tooth removed. Well, I made the appointment with Dr. Russell, and I came in, and she agreed with the endodontist diagnosis. We extracted the molar with sedation and placed bone grafting and started the process for an implant. I'm very pleased with the results. Nothing but compliments about the work. I cannot recommend Dr. Russell any more highly than I can. I mean, she was excellent. Her staff was very competent. They're very comforting staff. I required the sedation because I'm concerned about pain. I'll admit I'm a pain wimp. And Dr. Russell and her staff made me very comfortable throughout the entire process.
I actually had excess tissue that had developed on the lower lip or lower gum line. It was a bit unsightly, so I wanted to have that removed or at least lined up a little bit. Not sure the medical term, but it was basically to remove the excess tissue and make the gum line look more uniform on the lower part. The work was done very well. Dr. Russell made sure that she had it just so. We kind of had a little redo while we were working on the surgery, so she made sure that the gum line came out as evenly as possible. Experience was great, no problems at all. I would recommend her again because I actually had known her from her previous experience, and it's always been a friendly environment. I guess you'll say a family environment, so everything's very positive in the office. And that's basically why I'd recommend it to anyone else. It's been a good experience from the front door to the back, so to speak. So good environment, good staff, very positive, very friendly, very warm.
Initially, I had a tooth problem that cost me my tooth, and I wanted to get it replaced. And I remember that my good friend, Dr. Russell, is an oral surgeon, and I came to her to try to start the process of resolving the problem. I don't know the medical term for it, but I know that she did all of the surgery to prepare my mouth to receive the dental implant. It's a very good experience. It's a very family-like environment. Dr. Russell goes above and beyond her call of duty. She actually called me the night after the surgery, and she's called me ever since. Her results were so great that my daughter has to have 2 implants, and I've sent her to Dr. Russell as well. And the results and the treatment has been continuously professional, and also we feel very comfortable in her hands.